getting some medicine ready for a shave biopsy, which we'll talk more about in a moment. But first, get my medicine drawn up, my lidocaine. Not lidocaine with epinephrine because there's still a shortage. And we'd really like to get it because it makes for less bleeding when you have lidocaine. And then I put in some sodium bicarbonate. Just 0.2 cc's. Oops. Gotta hit this off by the hub. And find, and I see McNugs is here. Those of you catching this after the fact, there are people commenting during the live broadcast like Petra Rosenberg and Marcia Gonzalez and from Chile, which is pretty cool to have people in another hemisphere joining us. Let me throw away some trash here, and then we'll go get this done. Okay, so we're getting into room 4. Can I use your first name?
Sure.
Okay, so I'm going to set the camera up here where we can kind of see that we're in it. And say hi to Eric, everybody. Did he already do the prep?
Yeah.
Yep. Yeah, so I'll show you guys what we're working on. Ian did the prep already. And it's this spot here. We're going to numb it up, and then we're going to shave it off. Now, as you can see, it's similar to some other bumps on the back, although it is larger, and it's really been itching, and it's annoying. And oh, Petra says hi from Sweden. And so I gave him the option of taking it off and just making sure that it's not anything bad, because it is changing behavior with its itching. That's the difference. Close the door. I think Ian's coming back to help us. So we'll start. Oh, there's a lot of comments there. I didn't catch them all, but there are people learning about a shave biopsy. Now, did you get your iPhone 10?
No.
You're not getting one, are you?
No. Not anytime soon.
Is that because they charge full amount for it for you guys?
Yep.
Oh, okay. Okay, I'm giving an injection here. I can probably bring it. Oh, boy, you moved. Sorry. You know, I was just telling all the people watching that we don't have a substance called lidocaine with epinephrine that really limits bleeding because there's a national shortage. So bleeding's been more of an issue in recent procedures. Is this hurting at all?
No, just a little pinch now.
Just a little pinch?
Mm-hmm.
Okay. And I'm putting in 2 cc's, and what it allows is a lifting of the lesion above the rest of the skin, which really helps for getting it off. Also, pushing in all that fluid helps to limit bleeding to a certain extent because we're pushing the blood out of the area. So there's a couple of benefits from that. Plus, the more numbing agent we give, the less likely it is to be a painful experience. Okay, so I'll bring the camera over before I change into these sterile gloves. I'll get our little specimen container ready here. Okay, so these guys probably want to see what it looks like after. You can see that the it's kind of a ring around it of clear, not really clear, but white skin compared to the normal pinkish color, and that's because of all the blood being pushed out. And Beth from Fort Smith, Arkansas, has also joined us.
Hello, Beth.
Hello, Beth. Yes. You know what? This could watch from right up here. She thinks the connection's a problem, but surprisingly, we have a really good connection today. Sorry, I don't mean to show you guys the wall. I'm just getting this thing set up so you guys can have more of a view from above of what's going on. You can see it's here. Oh, the static. Yes, the static was from me handling the microphone. Sorry. All right, so sterile gloves. You can get some sterile gloves. Have we done this before?
No,
This is your first time.
this is my first time.
Have you ever watched any of the videos of one of these being done?
No, I sure haven't.
Okay, because we do a lot of videos of procedures, and a shave biopsy is probably the most common procedure that we do, or if it's not, it's pretty close to it. Is that your phone?
Sounds like it. I put it on mute.
All right, I'm looking now for a pair of sterile size 7 gloves. Do you know anything about glove sizes?
No.
So you're not going to make any comments about
No.
my small hands?
No.
I'm not running for president. Okay. So I'm going to put on sterile gloves. Boy, the comments are just going like crazy. Oh, Petra's telling me it's going to be great. Again, she's from Sweden. She shares with us her journey having cancer treatment, actually, in the Swedish healthcare system. So it's kind of interesting. Okay, gloves. And there we go. So there's no camera person today because we have, I guess I'll do this in a different direction. We have 2 MAs and 2 doctors and 1 PA, all seeing patients. So that's why there's no free hand for the camera. And this is very nicely removed.
Oh.
You guys want to see it? It's kind of hard to focus on it. Did you want to see it, Eric? You haven't seen it before, have you?
No.
So I'll put it in a specimen container. I will immediately dispose of the sharp. And we're going to put the wound seal on with my non-sterile hand, my right hand in this case. My left hand is my sterile hand still. And I'm going to pour the wound seal on. I'm going to start pouring it and then pull this away. And then push on it. And I'm timing about a minute. Let's see, do I have something? Yeah, I have something that tells me the time. The time for the video will tell me when it's been about a minute. So I just have to push on and give pressure locally.
Okay.
That helps to keep blood from getting into this powder that I just poured on. That's going to cause or create an artificial scab.
Okay.
So that you don't have to grow a scab and have a Band-Aid for days until that occurs. They'll just leave here already with one in place.
That's cool.
I'm checking the timer actually on the phone. We're using for a camera, and there are 28 people watching us.
Wow.
You didn't expect that, did you?
No, about 15 minutes.
Yeah, they get notifications. When you're in, like if you're subscribed to a channel on YouTube, there's a little bell icon. If you tap on that bell icon, then you can set it for notifications.
Oh, okay.
So that you know when somebody you follow, like if you follow Auburn Medical Group, you know when they go live. And let's see. Yeah, it's been a minute, so I'm going to take my finger off. And what I find is, except for where I kind of smeared it a little bit, it's perfect. But my finger slipped right when I put it on, so there's a little extension of it over here. I'm going to brush this off. I can put this in the normal trash, and then we're going to use the gauze to brush this over to the side. I'm no longer sterile, but I don't need to be because the wound is sealed. Okay. So can you feel it's kind of abrasive powder? That
Yeah.
Wiping down to the other side here. Do you get itching or tenderness in places where certain chemicals touch your skin? Sometimes.
I really haven't noticed.
The reason I ask is because it's looking a little red. No, it's probably just blood. So I'll put this here. Close up the specimen container. have you sit upright. Go ahead and sit upright. And I can't really show you the thing, but I'll show everybody else. Let me have you stand up for a moment, and I'll show. Let's have you walk forward so you can get some light on it. What the final product looks like. So we got a little bit of blood on the top and bottom, and then the wound itself is now sealed with the wound seal. That brown powder, the scab is intact. You can actually put your shirt on over that.
Oh, wow.
And if you want to see what it looks like, you'll have to watch the video.
You'll have to watch the video.
Watch it as you're checking out or something. Yeah, go ahead and put your shirt on, and we'll go ahead and if you want to say hi to the folks or talk with them. Beth says an artificial scab, wow. And Becky says, famous he is. Chrissy Poo says, wow, artificial scab, everything is now. Yeah, I guess so. So there. Oh, yeah, the comments. So there they are.
Huh.
Some gloves is a very respectable size, Doc. Thank you, Chrissy Poo. Don't you worry at all. Now those boys with any size 6, now that's where the marks begin. There we go. So, here, we'll make it look big. There, how's that? Of course, Dr. Gwaine always gives me a hard time about that. You'll be fine, Eric. Hi, Eric. It's going to be great, Eric. And now that you're on the other side, would you say that that's correct, that it was okay to go through?
Absolutely.
You're a very good patient. Mark, you're as good as always. That's from Petra. Jay Buggy. When can he wash it? Thank you, Jay Buggy, for asking that.
Good question.
Tonight.
Okay.
Yeah, bedtime tonight. It'll be ready to be washed. And Beth, hey Doc, was the green-blue thing that you used earlier, green-blue thing? Oh, you're talking about the actual blade itself. It's a flexible blade. If you look it up online, it's Biop blade, B-I-O-P blade. And it's just a blade that you can bend by squeezing it to get it to whatever size you want to go. So whatever size the lesion is, even though it's a straight razor, you can make it the right width as you go into the skin. And when we cut through the skin, it's not straight through. We're going from one side in and then coming out the other side, and it's a scoop that's rounded.
Oh wow.
Yeah, I don't have it round to show you anymore because it's gone.
That's
okay,
cool.
So we'll just kind of do a little sign off here. Hey, thank you everybody, and I need to especially thank my patrons. You've heard of Patreon? You're familiar with that, where people like give a certain amount per month. People support the videos with that, because it takes time and stuff. And so that is Petra Rosenberg is one of them who was on here today, and BooBoo Kitty, and also Lindsay Vaughan. So thank you so much, ladies, for the extra help you give. Eric, thank you so much for letting us do this.
Yeah, no problem.
And I hope you enjoyed it.
Well, it wasn't bad.
You can give the link to all your friends, or not. Okay, thanks everybody. Look forward to seeing you. And at 4 o'clock this afternoon, we have a produced video coming out. Right at 4 o'clock. The more of you watch it at that time, the better for boosting it on YouTube for people, for it to make the algorithm kick in so that it'll pass it around more. Thanks again. Till next time, Eric, Dr. Mark Vaughan telling you to stay in good health.